Thank you for being in the waiting room and coming in to this ACA Way Town Hall. Coming down actually live from three different cities, right? Jay, you're in Denver, right? Colorado,
Correct.
right? And Dalton, you're in California.
Palm Springs, California. It's
California.
105 degrees outside.
Yeah. And woo, you're in. We are in sunny Miami, down here. So we got a three wonderful states included, and everybody else is joining us from where they're coming from all over the country. Thank you for coming, guys. I was told to let you know that there is a translation feature where you can, if you are Spanish speaking and you would like to have the town hall live translated through captions. I think there was a slide showing you guys how to use it. If anybody has any questions on how to do the translation, please put it in the chat. And some people on the team will jump in and help you get translation. So there you go. Somebody's answering. Okay. So anyway, welcome guys. My name is Tony Feijoo. I am the founder and CEO of New Health Partners, part of the team that has organized the ACA Way. We're very proud of what's been done with the conference. This year, it is going to be an amazing conference. We have an incredible panel of speakers, even more that are coming in. The purpose of the conference has always been to communicate cutting edge, relevant information to the audience, focused on the individual market. Obviously, the individual market has grown to include group insurance through ICRA, and this word that we're all hearing on a daily basis called AI. And this year's conference is going to be heavily invested into all those three items. I just came back from a large agency summit in Baltimore. Maybe some of the people in the audience were there as well with CMS. And one of the most relevant, important panels in the conversation was AI and the utilization of AI in our industry. A lot of cool things were talked about in that part, and maybe we will cover some of it here because I don't want to steal the thunder from Jordan or Dalton, who are our feature speakers in this town hall. But some very relevant and important information as it relates precisely to compliance on the ACA and how to use AI compliantly on the ACA. So anyway, Jordan, Dalton, do you guys want to do your intros and maybe talk a little bit about where you are, where we are, and the items of interest that we want to cover here today?
Jordan, I defer to you. Ladies first.
Sure, I'll kick off. Hey everyone, hopefully I know some, if not many of you on this call. My name is Jordyne Cerullo. I'm the Senior Director of Agency Sales at HealthSherpa. I've been here for almost 6 years now. I've known Tony since the very start of it. He's been an excellent partner of ours and has really been wonderful to work with as the industry has evolved and changed throughout the years. And Dalton, a new partner of ours, really excited about the partnership that HealthSherpa and RetireFlo has together. Just super excited to be here with all of you. One of the things I've enjoyed the most in my role is really being able to connect with agents and agencies all across the country, understand the challenges that you're facing, try to break things down in a simple and easy to understand way, but then also take those challenges back to our team and make sure that we, as HealthSherpa, the enrollment platform, are providing tools and solutions to you to help you not only just manage your book of business, but grow your business year over year, work with you to talk to CMS to make sure that we're all pushing towards the same common goals, and really work together. The last 3 years, I'd say, have been very turbulent. We'll talk about some of that today, but We've been, I think, very reactive to what the government and CMS has thrown at us. And I think overall we've done a very good job, but we still have a lot of work to do. So, hoping to spend some time talking about what's on the horizon this year and how we can work together through that. But also, if you have any questions, this time is for everyone here. So please keep the feedback coming, and looking forward to seeing all of you at ACA Way in September. Dalton.
Jordan, thank you. Proud to be a new friend of the HealthSherpa team, the New Health Partners team, the ACA Way team primarily. I think I would be remiss if I didn't start my introduction by saying that my name is Dalton Miller. I'm the president and founder of RetireFlo, and I'm excited to go to Miami on September 23rd and 24th. I can't wait to be with all of you and meet so many new friends. A little bit about us. I started RetireFlo about 3 years ago. We are a intake platform. We help Medicare agents and, excitingly, ACA under 65, Obamacare field agents collect things that they need to help streamline the enrollment process. Whether that is collecting income information before a meeting, collecting things like drug lists, providers, collecting, finding out who's in the household and their respective statuses. And even we go as far as helping agents collect ACA consent forms. And as the CMS comes out with regulations and changes, we help agents stay compliant by helping them create paper trails of the data that they so desperately need. So we're going to talk a little bit about it here shortly, I'm sure. But we have a very, very exciting integration with our friends at HealthSherpa that is coming this summer and will be live in advance of our trip to Miami, and we can't wait to tell people about it. We believe that it will genuinely change agents' workflows everywhere. And so it's a thrill to be here today with the ACA Way team. So I'm very, very excited.
Thank you. Thank you, Dalton. Thank you for the great intro, and we are equally excited to hang out in September in Miami. I think the beaches will still be warm. The water will be nice. I know that everybody comes from the north. They jump in on 70-degree water, and I can't. Jordan, I want to start with you. You mentioned some things about regs and how Sherpa is adjusting. I know that you and I spoke yesterday. Whatever we're allowed to disclose publicly, because it's so regulated on the information. But maybe you can talk a little bit to the team here and to the attendees. Any preview that you can regarding how you, as the premier EDE in the country, are getting prepared or adjusting, because the changes are not just this year. The changes are going to happen over the next year and a half. And then some people in the audience might not be aware of what those major changes are, specifically on the 2027 open enrollment. So anything that you can share with us, it would be great.
Yeah, absolutely. And I think, as we kicked off this call, we mentioned the word that we use every single day, and it's AI. And I would encourage everybody, if you're not using AI, you need to implement it into your day-to-day. Things like the final rule are an excellent way to use AI. I can tell you that oftentimes I will take these long policy documents and I will pop them in AI and say, help me understand what this actually means. And then I will have conversations with AI around, like, help me understand the actual impact or break this down for me. So if you haven't tried that, please do. But some of the things that I think are important to have on your radar, Tony, you mentioned a few things for this year. The last 2 years have been tricky because there are some major changes coming, but they were stayed in court last year. And then there are some major changes that they tried to push through again this year that, as of last week, are now in court again. So those are the SEP verifications. That is slated to go live for plan year 27, but it's in court right now. So we don't know what will happen with that, but that would be SEP verifications on 75% of all SEPs going through. I don't believe we get any intel into like who falls into that 75% bucket or if it's just at random. But I think for any agents that have been writing this SEP, you're now seeing kind of the pain that comes with having to provide that documentation and the short turnaround that you have in order to get that. So that will be a big change that many agents are not used to because we haven't had SEP verification since before the American Rescue Plan Act back in, I think that was 2020, 2021. That one again on pause, so we'll wait and see on that one. Same with the income verification. So another big one here. This is if you report as an agent that your client makes 100% of the federal poverty, above 100% of the federal poverty level, but the federal data sources actually show that they are below that. So possibly falling in the Medicaid gap, it's going to trigger a DMI. The exchanges will also be required to generate a DMI if there's no income data available. So DMIs, everybody's kind of used to DMIs, but I think we'll start to see more of those pop up. You can't really game that system if that was happening in years past. That one is also in court right now, so we're going to wait and see on that. Another couple that are in court include the failure to reconcile. So worth mentioning because that's been a topic that has come up in a lot of conversations over the last couple of weeks. Before I dive into the specifics of that, I think it's important for everyone on this call to know that you probably have members that have received these notices from the marketplace. And we all know that they don't read them, they don't open them. In HealthSherpa, you can look at your follow-ups and see if any of your members received failure to reconcile notices. The hard thing is when a member gets a marketplace notice in HealthSherpa, we don't actually open the letter and read it. We are just alerting you that we see that in the subject line. So your member could have received, you are going to lose your subsidy, or you have already lost your subsidy. And a lot of these are happening right now. So Tony, at the NHP level, if we can help you, look at that across your full agency, we can do that. Everybody that's an agent has the ability to look at it within your account, but this is really relevant right now. So just be aware of this is the time of year that they're getting those notices. What this is with the final rule, same as last year, they're trying to change things to be a 1-year failure to reconcile. So if you receive APTC and you don't file your taxes, you are not eligible for subsidies in the following year. And then the last thing that's kind of in court right now is the no more standardized plans. To us, this one we kind of feel neutral about in general. Within the ACA, there may not be a big difference in the plans because of the requirements that they have in the exchange, but that one's also in court. So what I would say with those pieces is we'll have more information when we know, but that's as much as we know. The other things that are important, so you may have read about the consent requirements. Everybody will be required to utilize the CMS consent document, which I view as potentially a good thing because now they're finally saying what the actual rate form is or what the language should be. We are still waiting for additional clarification, but that one does not go into effect until plan year 28. So we've got some time to implement that. I'm sure Dalton will have that in place in his system. We'll have it in place on HealthSherpa. If you're working with an agency or a partner that you do your consent forms through, just know you'll have to use those CMS forms. A couple of other things to just have on your radar. So the things that we do know from the final rule that are going into place are the eligibility for immigrant populations. There are some populations that will no longer be eligible for subsidies this year. So certainly understand if you're serving that demographic, how that will impact your overall book. We'll have more information, and I'm assuming you'll be able to use some of our tools to filter your book and understand the overall risk. I can say in my conversations with agents and agencies over the past couple of months, it's worth understanding what can you provide these people because they are still going to need health insurance. So if they are not eligible for subsidies and they cannot afford marketplace plans, then you'll want to have another plan in your back pocket for them. And then I'm sure I'm missing one. Oh, and then we've got more flexible plan design. So 10-year renewable catastrophic plans, that's a big one, and non-network plans. So my advice to all of the agents on this call is make sure that you understand what this means. I was talking about AI earlier. I had a great conversation with Claude about catastrophic plans because I'm still learning about what they are myself. But I think as an agent, it's really important to understand how you differentiate between these when you're quoting your clients, how you educate your clients, because the last thing that you want to do is sell them a catastrophic plan and now they've got a 15,000 out of pocket exposure when they actually need more coverage than that. So just make sure that you're up to speed, you're doing your homework ahead of open enrollment. Let me pause there for questions. I've got one more I want to cover, but Tony, Dalton, any thoughts?
I did want to ask you a couple of things, Jordan. Um, from when I was listening to you on we all know that the majority, and I forgot the percentage off the top of my head. Maybe somebody in the audience will plug it in. That are under the 250% of the federal poverty line. The majority of the users of the Affordable Care Act fall into that category. We all know that the two major states that have the majority of the population are Florida and Texas, who do not have Medicaid expansion.
Mm-hmm.
And then we have what we call the Medicaid gap. I heard something in the conference, which I thought it was interesting, where they were saying that, because it's why it caught my attention to you. So if an agent is stating that a consumer is making 100% of the federal FPL in both Texas or Florida, there's going to be a data ping to the IRS or to whatever entity that will confirm whether or not last year's taxes reflected that. So maybe I'm getting too much into the weeds, because what I heard in the conference, and I remember turning over to United Healthcare, who was there with us in the meeting, and telling them, I don't feel comfortable with some of the stuff, is that, for example, if a member states that they're 105% of the FPL this year, but next year when they file their taxes, they actually fall under the 100%, which would make them not eligible for subsidies, and theoretically eligible for Medicaid, which in Florida it would not happen, or in Texas, because it's very, very hard to get Medicaid in the States, that there wasn't going to be any penalty on the consumer. So that was, and I think some of you that I'm seeing on the list, I might have seen you at the event. If you want to comment on the chat anything about that, because that caught my attention. So to what you just said is that at the moment of enrollment, if somebody is stating a percentage of income within the FPL, that it's going to trigger an immediate DMI if it's not matching a data source.
That's correct. And the way that it works today is the system already does a ping to, the IRS systems to look for tax data. And there's a threshold that exists of when a DMI would be generated. So you might see those more commonly with self-employed individuals, those that have incomes that vary year over year. The way I understand this so far is that because of that threshold, over 100% versus under, that's going to trigger it. So it would be different than this existing bracket that the CMS system has in place today. So probably just worth noting within your existing book of business who might fall into those categories. And I'm actually going to make a note right now that we should probably flag those in product, because that's just a different conversation to have with those consumers.
Correct.
I'm hearing this and I'm thinking to myself, and I almost, I feel for agents out there. It's disturbance after disturbance after disturbance. Communication going directly to beneficiaries about, their subsidy changing, or how that's going to impact the plan that they've ultimately chose. Jordan, you said, have a backup in place, and I think we're lucky in that for the 230 folks who are on this call today, it is June 10th. And, while we're excited to be with all of you down there in September, but this is a great opportunity when things are just a little bit slower. I'm not saying they're slow for folks, but a little bit slower in advance of OEP, to just check in with your book, to have those, to be spending time in HealthSherpa, looking at, okay, who might be receiving these notices, because I would much rather, as an agent, be sitting around, having an idea and a game plan in advance, rather than let these things hit me, kind of in the face in November. So I love when you said have a backup, because I think a lot of agents are going to need them, and whether that's at a micro level from a beneficiary by beneficiary basis, or from an agency level and saying, okay, who in my book of business, I have an idea who's going to shift, who are going to be my, I don't want to call them quote problem children, but to some degree having an idea in advance, because you don't want to wait till the 11th hour. And it's cool that HealthSherpa offers those types of features, but releasing those things in production would be massive helps to agents. The more that we can filter our book of business, I think the better.
We've got some questions, guys, that I think are relevant, and so we can address them. Quick question. So somebody who's new to the industry, welcome to the industry. We need a lot of great agents. So welcome to being an agent. A DMI is a data matching issue. That's when the consumer tells you, whatever information is being provided to you, and it doesn't match whatever repository of data exists for that consumer to match against. It could be an address, it could be a birthday, it could be an age, it could be immigration status, it could be income. So those are called data matching issues. The other question on the enhanced subsidies, I don't think those are coming back, guys. So everybody remembers that the enhanced subsidies came in during COVID, and I go to Washington plenty with the organizations that I belong to, both Health Agents for America, which, by the way, if you are coming to the ACA Way, and the ACA Way team, correct me if I'm wrong, but I think everyone is already getting either a free 1-year membership into HAFA or something like that. HAFA is the only organization in the country that represents agents' interest in Washington, D.C. And to everyone in this phone call, because I was one of those guys that I thought that my voice didn't matter. And I made my first trip to DC maybe 12 years ago. And it was a life-changing experience for me. I said, wow, these people do listen, right? And your voice does matter. And the US government works in crisis mode. So, unfortunately, that's how we operate. So it's always a crisis that has to be dealt with. The enhanced subsidies were in place, and just to give you some history, perhaps for the new folks too, the enhanced subsidies, we fought for enhanced subsidies before COVID because we wanted people that were above the 400% of the federal poverty line to get help. So when you look at the data, I think it was maybe 3.6 million people that were in that range. Over half of them were over the age of 40, which is when the wheels start coming off and you require to have health insurance. So that was the greatest pain that we have. And then we continue hammering our lawmakers that those individuals are truly making a decision of whether having health insurance or paying the bills. Because $1,000 in income for a couple that is 55 years old means paying maybe $1,800 to $3,500 in premium unpayable. So I wish I had a more hopeful answer to that question. regarding the enhanced subsidies, but I don't think they're coming back. It's an election year, guys, so things go crazy in election. Um, the conference information is going to be put onto the into the chat. Someone was asking us about the conference in September. And the last question, and Jordan, this might be a cool one for you, is, will you clarify and confirm what the marketplace uses as reportable income, and it is a gross or adjusted income? So maybe Jay, you want to take that one?
I can try. Um, Gosh,
Oh, I put her on the, oh,
I've
I
been
put her on the
removed from the
spot.
applications for a while.
I put her on the spot. I put her on
I
the
don't
spot.
know. I don't actually know offhand, but I will get the answer to that if it's gross or net income. What I
Yeah.
can say is that if you generate,
W2 is gross. W2 is gross, right? So I think it was line 37 on the 1040. I mean, like it's
why did you
that.
even ask me? You already know
I,
way
I
more.
wanna, I wanna, I wanna see you blush, man.
Yeah, just get me in your Tesla. You can do it that way.
Uh,
What I can say, and I've been answering some questions in the chat. I'll drop over some resources if I have any that are useful for all of you. But if you generate a data matching issue in HealthSherpa or a SEP verification issue, one of the things that we provide to you are resources of what documents are acceptable. So we're going to tell you a full list of what CMS accepts. We'll also give you a link directly to the CMS website if you feel like going over there and trying to find it on one of their easy to find websites that they have. So if you do generate one of those, we'll tell you what you can upload. If you have questions, you can always contact our support team. They're much better equipped to answer application questions than I am as well. So hopefully.
oh, listen to the political answer. Good job. Yeah. Um, uh, a couple of questions that came up that I thought were relevant. Sandra, good to see you. Miss McDowell, if you are under the 100% FPL, you do not get subsidized, right? And the Medicaid expansion states, you get automatic Medicaid, but in the non-expansion states, if you're making less than 100% of the FPL, which is ironic, right? Or sad, or whatever you want to call it, you don't get any subsidy. There's options. I think that Jordan and Dalton spoke about it. There are going to be a lot of options this year, guys, in the market to help those individuals in either end of the spectrum. Um, Sean is asking us, how will auto enrollments be handled? So this is one of the amazing, for lack of a better word, right? Auto enrollments this is the last year of auto enrollments. So next year, we must actively enroll each and every one of our members.
Whoa.
Yeah, and there's been conversations on how to handle that bulk of work, including maybe allowing us to start doing some of that pre-work prior to the open enrollment. I don't know how much of that is we can still share or not, Jordan, because I know that some of that stuff is still being decided by CMS.
Yeah,
Um,
I've got some insight into it. So we know we're hoping to have more information by the summer. Again, because this is next year, my mind is saying this is a next year problem, but you still need to be aware of it. There are a few things that will have to be confirmed, and I actually learned these as I was preparing for this call. So household income and family size, whether or not they are an eligible alien, any coverage status or eligibility, their place of residency, and any additional information that the secretary deems necessary. So, all that to say, TBD, what it ends up looking like. There are some changes, Tony. You heard this last week in Baltimore. That are coming this year that hopefully play into what we see next year before they say passives go away. Hopefully, they allow a little bit of ahead of open enrollment preparation. If appropriate, I can talk a little bit about the agent authorization that we know is coming for this year now.
Yes.
Okay.
Yeah. So yeah, absolutely, absolutely. I wanted to jump on Dalton for a sec. because I want, what Dalton does is close to my heart, right? I've been from the mountaintop screaming for the past 13 years, aside from all the fraud stuff and having proper guardrails that will eventually eliminate fraud from this industry, right? The enrollment fraud, it is my belief that by 2027 is going to be almost to non-existent, right? I think CMS finally understood that technology is needed to verify both agents and consumers to eliminate the fraud. And it's something that we all have been dealing with ourselves as an FMO, carriers with directly appointed agents. We've all been dealing with that problem. I told CMS 3 years ago, 4 years ago, look, guys, let's just talk as people. We are going to eliminate fraud together, right? It's a big problem. It's a big problem. And when we were in Baltimore in the session, and we had a closed session with my FMO partners, very, very good people that are in our industry, we are all being attacked by it, right? I mean, we can it's being propagated all over the industry. But I said, we're going to deal with that eventually. Technology is going to eliminate it because Dalton will tell you that in Medicare, there's close to zero enrollment fraud.
Right. That's
right.
Zero, exactly right. Yeah.
But what Dalton is doing is super cool because I always told CMS, guys, we need to encourage utilization, right? When you look at the Affordable Care Act was a great thing, right? It was a great thing. You can be the richest country in the world and not offer guaranteed issue coverage to its citizens. We took care of that. We took care of no limits on coverage for catastrophic. We did all those cool things. It's still not perfect. Nowhere near being perfect because healthcare in this country is too dang expensive. But what's going to drive prices down, aside from price transparency and all those cool things that we're hearing that are being talked about in Congress, is utilization. It is health risk assessments that alert the carrier of the block of their book that requires care coordination. So, I'm a big fan of what Dalton does because eventually that is what's going to save the ACA is utilization and knowledge of conditions that can be treated before they become chronic. So Dalton, if you want to add a little bit about that, that would be super cool because I know that's your world.
Absolutely, and I appreciate the compliments because while you're a big fan of ours, we're big fans of yours, and the agents who are on this call should feel lucky that we got a guy like Tony who goes to Washington as often as he does. He probably doesn't have to, but he does because he cares, and so thank you for that. If I don't get the chance to thank you in private, I'll do it in public. But you're 100% right about the difference between these two industries. A little bit of history, I think, is important here for context. RetireFlo, I started as a Medicare agent. That was my birth into this industry, which was not, I will be honest with you, not that long ago. I started as a Medicare agent about 7 years ago, and we truly struggled with, the constant turnover and the churn between beneficiaries wanting to shop. And I come from an agency, it's my dad's Medicare agency, where we serve 25,000 clients and we just have 8 field agents. So we don't manage a call center. We don't do it like that. We're exclusively in person, on the ground, in the field. And what we found was that what was really working for us at our agency was sort of sitting sidecar and having an advisory role ultimately to the beneficiary. And in doing so, I think what was illuminated for us was that a lot of times beneficiaries are being encouraged to identify and ultimately enroll in a plan without taking some of their very serious, health, the things that are taking place in their universe into account. I tell Medicare beneficiaries all day long. I live in Palm Springs, so there's a lot of senior citizens in my community that you must take into account your drugs, doctors, hospitals, and pharmacies when you're ultimately choosing a plan. And the reason why that's important, and Tony illuminated it, is that when those things are taken into account in the enrollment process, a beneficiary is happier with their plan and more likely to use it because they know that their doctor's in network and that their prescriptions have, or at least have some context into what their coverage looks like when they go to the pharmacy. And so my goal in coming to Miami and talking to ACA agents everywhere is that maybe we should consider, as ACA agents, taking a little bit more of a Medicare style process to this industry, because one, you're 100% right, Tony, it will drive utilization if they know that their doctor's in network and that the communication channel between beneficiary to agent to provider is streamlined and uniform. That's a better universe. But more importantly, I would argue, for the 230 agents who are participating in this, it's a better life for you when your beneficiaries are more informed and can ultimately easier inform you about their health regimen. That is the most important thing in this process. That is, we offer health coverage. That's what we do as agents. And so we need to take into account, what prescriptions do people take? Where are their providers? Obviously, and Jordan mentioned it a moment ago, these things, understanding income levels and who's in the household are going to be ultimately requirements in this process. Making sure that there is proper attestation and consent, and it is documented, and there's a paper trail that observes that, so that way there are no bad outcomes. But that's what's important, and what that leads to for the agents. Obviously, utilization is a fantastic thing. That's why I don't want to enroll somebody in a plan that they don't ultimately utilize to the best of its potential. But more importantly, as an agent, I want to keep clients around. I want people to look to me as their agent. Hypothetically, I'm not an agent anymore, but you as an agent are a pillar in somebody's community of service. You identified something that was complicated for someone and made it easier. And so if I want sticky retention, my clients sticking around, I want to make sure that they have good experiences when they go to the doctor and they go to the pharmacy. And that starts at enrollment. That starts on the front end. So it's the moment that you get to know a prospect. It's the moment that a client calls you and wants to see if the grass is greener during OEP, if there's a different plan. Maybe it's the moment that you have a discussion with them, and maybe not even a great discussion with them about their subsidy. But if you have the chance to say, hey, look, I'm going to take these important health metrics into account in this process, transparency will keep your clients. And so, because we don't want them seeking guidance anywhere else. So I think from all the way from plan utilization down to your relationship with the client, I think, having a proper intake solution like RetireFlo is a great answer. And who doesn't want to retain more business? That's a great way to scale your agency, not necessarily, looking for new clients on every single corner and every single day. I like retention. That's a little bit easier. I'm sure Tony would agree, but that's how
I'll add something to what Dalton is saying, because what we're trying, I've been an agent for many years. I was an agent long before the ACA was even a thing. And I was part of a group of people in the country that actually piloted the ACA in Florida. There was other parts of the country where there was called different names. But where I'm going with this is that prior to the ACA, agents, we had a different respect in the industry, right? As an agent, I could call a carrier and say, hey, Mr. Carrier, Dalton is no longer going to be effective with you July 1st. And my word was accepted. Some wanted it in writing, but today none of us have that power, right? We have been relegated to be order takers, and we are fighting that at a legislative level. And the reason why it's connecting to what you're saying, Dalton, is that information that you are collecting on behalf of the consumer for the carrier saves those carriers millions of dollars. My good friends from Agility, who run a magnificent FMO out of Texas, Steve, who's the owner, friend of mine for many, many years, he told me something in Nashville. It's like, hey, we need to get a raise for the agents. And I go, man, he is right. He is right, man. We need to go fight for a raise, but we need to justify it to the carriers. And the point is that the information that Dalton is collecting is gold for the carriers, because that'll be another town hall if we want to nerd out on the finances of the ACA,
Oh
on why
yeah.
it's so valuable to them.
But imagine a universe, and I don't mean to interrupt you, Tony, but imagine a universe for agents where there is a simple way to collect that stuff. Because right now it is a little bit hodgepodge, and especially coming from the Medicare universe, it was more hodgepodge. In the Medicare universe, agents would call or reach out to their customers, and they would ask their beneficiaries to mail in lists of prescriptions, mail in list of providers. And ladies and gentlemen, it's 2026. The agents were sending out printed mailers with return stamps. And I don't know who here has watched Seinfeld, but we all saw what happened to George Costanza's wife when she licked too many envelopes, okay? She ain't around no more. And so we want to bring that same efficiency that all these Medicare agents found in RetireFlo in Medicare to the ACA universe. Imagine a universe, and I'm not imagining this is coming in weeks here with our partnership with HealthSherpa. I'd be remiss if I didn't talk about it because it's awesome. You, using RetireFlo, can send out a link, just one link, retireflo.com/Tony, if Tony were to use it, to your entire book of business. Get fresh, healthy looks at prescription lists, providers, get fresh ACA consent forms, all that updated demographic information, all that stuff. We would give you a compliant paper trail of it stored in RetireFlo, but then more excitingly, it uploads right into HealthSherpa. You as the agent log into HealthSherpa, you look up your client, and you press run quote. That is a streamlined workflow in my mind. That is not having a conversation about, is there a better option there for me? And then you have another phone call where you go, well, tell me what prescriptions you take, beneficiary. I don't want to listen to my clients spell levothyroxine over the phone. I don't have that kind of time, okay? And I love our clients, and I love the people that we serve. But if we can streamline that for you, and that's what RetireFlo it does and will do for agents across America, this OEP. I get like giddy thinking about it, Jordan, because it's just going to be a different universe for agents. There will be a before and after time. It's before RetireFlo and after RetireFlo. Just you got to not only collect this information, but you have to have a timestamp record of it. If you don't, you're putting yourself in grievance risk. I don't want to live in that zone where I'm in a he said, she said situation with my beneficiary. I'd rather have a transparent conversation with them and utilize tech to do it. So that's, it's just true. I mean, it makes me excited.
Listen, every time we do these, the time flies because we get into it.
I know.
And there's a lot of questions that come up on the chat. If we don't get to them live, guys, I promise that we will. We do it every time. We'll get back to you on answers. There's been some questions on immigration. Whether or not TPS is going to be allowed. That's a moving target. It's a moving target. we don't know. We think it might be, but we don't know what's going to happen finally with the immigration law, and those, poor individuals that are now going to be in an illegal status over the way that we're handling immigration law. And please do not interpret anything that I say as political. I'm just stating things as they are. There was another interesting question. Are you going to be obligated to pay back the APTC if you come underneath the 100% FPL? The answer to that is no, and I heard that in Baltimore, when I was in Baltimore. But Jordan, I wanted you to jump back in and add anything you think that we might have left out from your side. I did have a question to ask you, because it's all about flow, right? When CMS has their official consent document, is that going to be built into the Sherpa flow, or is it going to? Okay, so the answer is yes.
Yeah,
Okay.
we're already way ahead of that. When we need to have it incorporated, we will. Whatever they'll allow us to have, whether that's English, Spanish, other language support, we will be ready for that. So I think one more piece to add before we talk about one more important item I want to cover is that obviously a lot of changes happen every single year. I know that the carriers will do webinars, a lot of FMOs do webinars. I think one thing that we as HealthSherpa do very well is because of our relationship with CMS, we've got an excellent policy team, some of which are based in DC. We do a really good job of just taking all of this information and getting you all answers and turning it into FAQs and webinars. So if you are writing ACA, which I'm assuming you're all here for the ACA Way, so you're writing ACA. Look for our newsletter. We do webinars on this stuff. So as soon as we have enough information to come to market and say, this is what you need to know, those are the ones to go to. And if you can't make it, just watch the recording, put it on 1.5 speed so you don't have to sit there for an hour, or just call our support team. We have so many resources for all of you, but there are still a lot of things that are not answered yet, and we're in the same camp of we don't know what it's going to look like. So if you have questions, please feel free to send them to us, send them to HealthSherpa, send them to Tony. We will flag them with our partners at CMS and do everything that we can to get answers, but know that once things are finalized, we will be ready, not only from a product perspective, but by educating all of you so you know what to do and you can educate your consumers as well.
Thank you, Jay. I know we have about 10 minutes left, and again, folks, we will answer your questions via email, and share them with everyone. So if something was left out, and feel free to, to Jordan's point, send us any questions that you have, because we will, if we don't know the answer, we will get you the answer. But I want to talk a little bit about AI in this meeting, because I want to warn you guys about the proper utilization of AI. The ACA Way this year is going to be highly focused on AI technology. Our title sponsor is an AI technology company that is focused on healthcare, which is that little robot guy that you see hanging in our backdrop, Theo. And actually, the CEO of that company was in a panel at the Baltimore CMS agency summit, and something that came up that was incredibly important, that you guys are all aware of this. You cannot put PII information into a chat GPT engine, Claude. You cannot, right? And look, this isn't a baby industry, right? And we're all learning how to adjust to it. You cannot upload commission statements into a chat GPT. You cannot upload any personal information from your consumers, because those large language models are training on the information that you're providing it. Now, everybody's using it for their personal, hey, I'm uploading my blood work, and I ask ChatGPT, hey, how am I looking? That's okay. That's your information. By the way, you're sharing with the whole world, because there's still, you're not sharing with the whole world. The engine is training on your data. The Theo technology is the only engine in healthcare that does not do that, and it is HIPAA compliant with data that you're putting onto it. So if you're uploading consumer data onto your personal AI account, it's not compliant. Do not do that. It is a PII and boo boo, right? So for lack of a better
Oh,
word, yeah.
I
So
might be
don't do.
boo boo might be too nice of a word. I always encourage agents, if you are considering utilizing a technology tool, there are certain data security credentials that you absolutely must meet. Looking at things like HIPAA compliance and looking at things like SOC 2 Type 2 compliance, encryption levels, and things like that. I feel like and as an ACA agent, I feel like I'm in a trash compactor, like in Star Wars. I don't know if you guys have seen that clip in Star Wars, where this upcoming OEP, we have all of these subsidy changes and all these regulatory changes to manage it, and then simultaneously we have all of this frontier new technology of things that I manage and run a technology company for insurance agents, and this stuff is even new to me, and I've got this sort of closing window on me that feels stressful. And so I look at this, I look at what we're going to be doing here in September, and if I'm a field agent, I'm going to find my way to get my butt to Miami and go to the ACA way and figure this out, because and I'm not saying that we're so excited to be there, but if you are a insurance agent in this country who is licensed to write and appointed to write under 65 health insurance, individual coverage, you got to take an active approach in your business. And I don't know if there's going to be any better way that in a 36-hour period or 48-hour period between September 23rd and 24th to get schooled up right before OEP starts on these two converging fronts. Because one, you got to stay compliant and stay up on top of things and make sure that you're following all the regulations that Jordan and her team work so hard to mitigate for agents. But then also, how can I use technology to serve my business? Because there are people who are on the cutting edge of stuff, Tony being one of them. But if you're not on the cutting edge, you might get caught in the trash compactor. And so, that's my 2 cents on this is find a way to be there. Because I'm learning.
What I find
Go ahead,
what I
Joy. Go
find
ahead, Jay.
interesting is, Tony, you asked me to be on an AI panel last year at ACA Way, and I was like, I barely even use AI. I don't know what you're talking about. I sat up there like I've got nothing to add except just sitting there and listening to all the smart people I was sitting next to. But it's crazy because in a year's time, it hasn't even been a year since last year, I'm coding on my computer. I'm using AI in ways that if you told me I would be doing this year, I would have laughed at you. And so that's where things like the ACA Way conference are really valuable, is you can network with people and understand how they're using technology, ask questions. Is this compliant? Should I be doing this? What is your business doing? Because we're all in this together and we all want to support each other. With all of these headwinds, we just have to be working smarter. And so all that to say, we'll be having this conversation again next year, but lots of good things on the horizon. And I think we have to just keep talking about them to understand how we as an industry can evolve compliantly.
I say it every day 20 times. The next 2 years are going to change our industry dramatically. It's going to change the way that we interact with our consumers, and we need to be educated on the tech that is going to facilitate that. I'll mention a couple of quick things. There was a cool question that I'll address it as quickly as I can. Prior to the ACA Way, there are going to be workshops that we're going to be doing for the folks that are attending on how to build AI robots, how to work with AI technology. We want you to be somewhat prepared when you get there, with the amount of information that we're going to give. To Dalton's point, is 2 days of 2 days of massive information. So we decided that we want to be able to prepare folks that are coming exactly on AI technology with hands-on work. We have a question from Nitzara Vega, which I think is a great question. There was a slide in a conversation in Baltimore about what's called non-network plans that CMS is proposing, and that they want to hopefully have them for either 2027 or 2028. So Nitzara, non-network plans, the goal of that regulation, because it's not law, is to expand the access to care to the consumer by not being associated with a particular plan. So it would be, this has been done before to some extent in other types of business and insurance, where you have doctors that are participating in these large networks that are not particularly married to one insurance carrier. And that's the simplest way to put it. I think it's going to be super cool. I think it'll help drive prices down in the industry. I don't think it's going to be easy to do, because there's a lot of pushback already from hospital systems and the people whose pockets are going to be affected. Jay, I don't know if you have any comment about that, or have you guys at Sherpa even talked about it at all? It's all very brand new stuff.
I haven't been included in those conversations, but I was reading about non-network plans this morning, and while I understand the idea of consumer choice, and I think it's very cool, and myself as a consumer, I find that very interesting, being able to shop for the best possible price for providers or whatever services I'm looking for. But back to my earlier comment around needing to understand what you're selling to your clients, whether it's a non-network plan, catastrophic plan, this will be huge, because if you are selling your client a non-network plan, they need to understand how that works, how to advocate for themselves. And so this is going to be a fundamental shift in the industry if these do go into place. And so just wanted to add that comment, that I think, a couple of takeaways from my point of view. The best things you can be doing to prepare for this open enrollment are educate yourself, educate your consumers. And I had a third one and it just left my mind, but those are the two ones to focus on now.
You're too young for that, Jay. You're too young for forgetting stuff. I know we have a couple of minutes left, guys. There's going to be some, I think that there's going to be great promotions to allow agencies to bring all their agents into the ACA way. We wanted to have something on the southeast of the country, so allow people that are not able to go to other conferences, which are great, by the way. I'm good friends with all my friends at Medicarians in the ACA Summit. Those guys are great guys. They do a great show. But I know it's difficult to get out to the West, so that's why the ACA was born. The ACA Way was born to allow for that. All kinds of cool discounts that are going to be published soon. Because we want agencies to bring everyone in their team, because knowledge is power, guys. Knowledge is power. Any last words, Dalton or Jay? Because we've got 1 minute left.
Thanks for having us. This was awesome. Happy to be again.
Thank you, and we're so excited to be with you in Miami. We can do events like this, and it's awesome to talk to 200 agents across the country. But I think it's just even more meaningful when we get to be there in person. And I can't wait to learn about everybody's agency and ultimately help people get better, write more business. So come to Miami. We want to meet you.
And if any of you want to ever nerd out and talk insurance with me, I am the super insurance nerd, and I love talking about it. And because I do believe that it is our mission as agents to be part of the movement that lowers the $5.8 trillion expense of healthcare in our country, which is unsustainable. And that should be the biggest mission that we all have as insurance agents in the country. Thank you guys. God bless you all. And I'm looking forward to seeing you in September.
Thank you.
Thanks, guys. See you later. Great to meet you.
Bye.